My name is Moxie. I'm an essential worker myself, and I've worked for the past 18 years in downtown Toronto within the mental health, addictions, homelessness, and anti-poverty sector. I will be facilitating this educational over the course of the next hour, hour and a half. This educational is being hosted in partnership with the Communist Party of Ontario and the People's Voice Media. The People's Voice is Canada's leading socialist news source and values people before profits. The People's Voice shares stories of working class relevance. So please consider subscribing, and please consider even donating if you can to the People's Voice, because it really is an essential news source that's very relevant to the working class. So the link will be posted in the chat discussion. I think, Drew, you could probably help us out with that at some point. And just follow the link. Tonight, we will discuss some of the working conditions and social aspects of the critical, essential work of long-term care workers, healthcare workers, and anti-poverty workers that are working on the front lines. Excuse me. Our guests will highlight the challenges and struggles this sector had faced prior to COVID-19 and why during this pandemic, our workers and the populations that we serve have been impacted the most by COVID-19 here in Canada, Ontario, and Toronto. We are streaming this from Toronto, and our guests this evening reside and work in Toronto, Takaranto, the dish with one spoon. Toronto is located on the traditional territory of many First Nations, but namely the Haudenosaunee, Algonquin, and is the treaty territory of the Mississaugas of the New Credit. These nations, as well as many other nations throughout Canada, have existed on Turtle Island long before Europeans colonized this land. Colonization continues to happen today. We allies, comrades, and friends living and working on these unceded territories and this unceded land recognize that First Nations and Indigenous peoples in Canada are still fighting every single day for their treaty rights to be honored, respected, and recognized. Treaty rights that have been agreed to by the Canadian government since the 1700s, and that should provide access to traditional practices for Indigenous people and First Nations around hunting and fishing rights, and basic essential life needs like access to clean drinking water and education, safe housing, and of course, accessible health care. We host this evening honoring this land and what it provides to us, all of its workers, living and residing among it. So tonight you will hear from rabble.ca journalist, Zaid Nororsumar, Gregory Cook, a frontline anti-poverty worker in the downtown East Toronto, and Natalie Mehra from the Ontario Health Coalition. There may be somebody from the Ontario Nurses Association joining us later, but we're not sure if he's able to join us. You'll also hear from Helen Kennedy and Stephen Seaborn, who are from the Public Sector Workers Club, and both of whom are active, very active, QP Union members. So we are happy again to have you all here tonight to chat about this important work before and during the COVID-19 pandemic. During our discussion, we will we'll keep an eye on some questions that you may have, so please post them to the moderator. Dominic and/or Stephen is going to help us out with answering some choice questions. We won't be able to answer all of them probably, but we'll definitely pick out a couple of questions after each speaker and discuss some of those things deeper. Excuse me. So I guess we can go to our first guest. We have Gregory Cook. Gregory. There you go. Hi, Gregory.
Thanks for having me.
Nice that you're here. Thank you so much for joining us. So Gregory, you are, tell us about yourself. You work in a drop-in, right?
So I'm a I work in a drop-in and I also do outreach. We have a fairly small organization, so kind of wear a few different hats. I've been working at Sanctuary, which is in the downtown east of Toronto, since 2009, and I worked at a youth drop-in a bit before that. And so been doing this for a while. What else? I'm also on the steering committee of Shelter and Housing Justice Network, which is about a year old. Basically it's a kind of a network of different agencies that really try to push, at this point, mainly the city, to do better around housing, and also just to make sure that people have spaces in shelters, and kind of address the housing crisis. And I also am involved with the Toronto Homeless Memorial, trying to keep track of and acknowledge and remember people that die without housing in Toronto. So those are some things I do. Yeah.
Yeah, and thank you, because it's important work. And I also have done that work as well, and I'm part of a weekly meeting with you for the faith-based organizations in the downtown east, and trying to strategize a network around how we can provide a continuum of service, because a lot of drop-in services, food access services, harm reduction services, and shelter services have really proven to fail even more than they already had pre-existing COVID. So shelter and housing services were already at a state of crisis, right? We see the ground zero of that crisis in the work we do before COVID happened. Thousands of people throughout Canada are homeless, and Toronto is the epicenter of homelessness, Vancouver as well. We've seen since prior to COVID, we had there was an overdose epidemic concurrently happening with the housing crisis and the lack of housing. Homeless shelters were overcrowded on a continuous basis. Housing was being commodified instead of being treated as an essential human right and human need. And some, these are leading to conditions of congregate living situations being very, very cramped. So of course, social isolation isn't possible, right? So not only that, and I know you work with a number of people who aren't even accessing shelters, and a huge population, I think it's about 16% of the homeless population right now in Toronto is Indigenous people, and many of whom are women as well. And at the sanctuary, can you explain a little bit about what you're doing right now in dealing with sheltering people who are homeless? How are you managing as workers? What kinds of things are you doing as workers, caring for this population? But also, what is the population going through too? If you can touch a little bit on those two things, that'd be great.
So just a bit of background. I'm just going to back up a bit, and I'll get to your question. So I think one thing that I haven't had tons of time. Usually I like to go for long walks, but I haven't had time recently. Been working long hours. But one thing that I found really helpful recently was Arundhati Roy made this statement that the pandemic is sort of like an MRI on our society. And so all this stuff that maybe that kind of maybe a bunch of us can ignore has kind of is in our face. So I think that's very clear with people who don't have housing, right? Those of us that have housing, shelter in place, we're staying home as much as we can, say going to the grocery store every 2 weeks. Maybe we're getting paid, maybe we're not. That's kind of scary. But if you don't have housing, you just don't even have that option, right? And so, and things like if you lost work because of COVID, there's CERB, so you get some money. If you're on like ODSP, which is Ontario Disability Pension, or you're on Ontario Works welfare, the most you've got is $100, and you had to ask for it. So it's like you got a humanitarian crisis for people that don't have housing right now.
Yeah, you said that. It's true. Humanitarian crisis. Yep.
And so, but in some ways, people that work the kind of work that I do, I think we're used to crisis, right? We kind of that's the work we do every day. Like if you don't have housing, you're in constant crisis. And so, an author that I'm going to read a quote that I find really helpful in thinking about this is Rebecca Solnit. She wrote a book called A Paradise Built in Hell. So I'm going to read it here. The positive emotions that arise in those unpromising circumstances demonstrate that social ties and meaningful work are deeply desired. readily improvised, and intensely rewarding. And I think we can all, like, as workers, like, I mean, I think this is showing which work is essential, or which work is really important, right? How many of us are like really sad that middle managers aren't telling us, like the people that, like, it's nurses, right? It's people delivering food. It's kind of it's workers who are making this kind of, that's very apparent to everybody right now. I mean, David Graeber wrote a book called Bullshit Jobs on how, like, so much work in our capitalist system is kind of like, why are they even getting paid? Anyway, so I'll keep going. What prevents these things from arising most of the time is the very structure of our economy and society. It's also ideological, a philosophy that best serves the wealthy and powerful, but shapes all of our lives, reinforced as the conventional wisdom disseminated by the media, from news hours to disaster movies. The facets of that ideology have been called individualism, capitalism, social Darwinism, have appeared in the philosophy of Thomas Hobbes and Thomas Malthus, but also in the work of most conventional economists, who presume we seek personal gain for rational reasons and refrain from looking at the ways a system skewed to that end damages much else we need for our survival and well-being. So I think the pandemic has broken this open, right? I think that it's kind of made it, like, many people who often don't look at this have to look at it. And so I think, but I'd say at the same time, working in a situation where every day you're kind of rubbing shoulders with people that don't have housing or in constant crisis. You look at the last, say, 2 decades of, like, Harper, Trudeau. In Toronto, we've had Tory for 6 years. Before that, we had Rob Ford. And so in that time, the housing crisis has got significantly worse. It's almost doubled, right? In Toronto, rents have almost doubled, right? ODSP hasn't doubled, right? OW hasn't doubled. Minimum wage hasn't doubled. And so, of course, you have this huge housing crisis. People just can't afford basic, like, rent. And so when 2009, even 2012, you had about 5,000 to 6,000 people in the shelter system in Toronto, because that's how, and already we were fighting, we were saying it's too full. So right now the shelter system holds about 8,000. The homeless population is pretty much doubled. We have more people outside. And
Gregory, what's being done for the people? Because I know a little bit about what's being done for the people in the shelter system. There is some emergency measures that have happened where hotels are being opened and being run by nonprofits and some city, as considered a city service, in order to create social distancing within the overcrowded shelters, right? There's also been emergency housing that is people are being quickly housed, which, you know, us workers have been asking for decades. Decades. There hasn't been public rent guaranteed income housing built in 30 years in Toronto. And if anything, a lot of the public housing stock is being sold off, right? So we have that contributes to an affordable housing crisis. And when I say affordable housing, I mean no more than 30% of your monthly income. That should be affordable, right? So a lot of people have become homeless because of what you said, you know, that neoliberal, housing as a commodity versus a human right type of model. So in the shelter system, staff, about a quarter to half the numbers of the shelter positive COVID cases right now are staff, because they're also working in overcrowded conditions, right? And I think
the other thing that people are pointing out, similar with the long-term care homes, because for most shelter workers, for example, it's poorly paid, and it's you kind of get as many hours here as you can. You got to work at a different shelter, different agency. So people are moving, like, it's just an awful situation. Again, it's kind of, the pandemic has highlighted this really awful, like, work situation, because then what happens is you have staff taking the virus to multiple shelters and infecting people that are really, frankly, vulnerable to dying from the virus. And so it's I mean, that's same with the long-term care facilities. So you have these congregate settings, which all over the world, that's where the outbreaks are happening, whether it's Singapore, they've managed it really well for the general population, but it's the migrant workers who are in dorm congregate settings where there's outbreaks, and And so then people who are wealthier start to pay attention because they don't want to get sick.
Yeah, that's a very good point. Yeah. And we just have like another minute, Gregory, but before we move on to our next speaker, Zaid, I just wanted to really touch a little bit about what the ingenious workers, because at the end of the day, many of us workers get into this field for a few reasons, right? Partly because, the caring field tends to typically be marginalized people from intersections of marginalization ourselves, women, people of color, racialized workers, people who have also experienced poverty throughout our lives. And also we get into it because it tends to be jobs that hire quite often, that have high staff turnover rates because it's high burnout, let's just face it, it really is. And the trauma and transference and those kinds of things. So a lot of the work we do is extremely difficult. It's taxing, and like you said, it's underpaid for the amount of importance that is involved in the work that we're doing, right? Essential work. But workers are ingenious, and the workers at the sanctuary have been, and you have done some really innovative, important stuff for people who are actually homeless. Do you want to talk a little bit about that?
Sure. I mean, it's a bit of again, so before COVID, we've owned the building for 20 years. And in that time, we've asked that people not set up tents on this space. So as of December, before COVID happened, we changed that policy and said people could keep their tents, basically because people were dying because it's freezing out and people can't get into housing, right? And staff, you have housing workers burning out because they're trying to get people into housing, and you can't make the money work, right? That's the other thing that happens in this kind of intersection of these big structural changes, and your job is to care for people who are dying, right?
And there's no resources for housing workers to even do our jobs properly, right?
Very brief, try to keep the story short. So basically we had a big conflict with our local elected official, who I won't name, because they obviously got a lot of complaints from our neighbors. We had about 10,000 people move in next door in the last 10 years to do kind of super gentrification. And some of them weren't happy. And so we had a big conflict with the city. We moved them on eventually, but then the pandemic hit, and then you have literally hundreds more people out on the street. And so we just started giving out tents. And so sort of what happened is you have this confluence of the city doesn't like people complaining, calling 311 and complaining about people in tents living next to them. And so they're sort of forces their hand. We didn't we have had some forethought on this, but, and so basically what happened is the city almost was forced to do the right thing and actually put people into temporary apartments. Ideally they wouldn't be temporary. Basically, I don't think because they're altruistic, but basically they got so many 311 calls that, and so we worked with the city to help make sure that transition was as smooth as possible. And we continue to kind of work around how do we support people now that they've been housed, because moving, even if it's to a better situation, is always difficult. That's the short version, yeah. Yeah,
but I think that's an important piece, and we're going to move on very, very soon to Zaid. But the important piece, I think, a takeaway is that we can do something. People here tonight, calling 311, calling 211, that's a start, because we want to keep the momentum going. These hotels that have been open for homeless people, these, the $4 an hour and $250 a month hazard pay that has been offered by the government. We want to keep that. We want to keep that, right? So we need to continue to fight for this stuff collectively, right? So thank you so much, Greg. And there'll be, if there's anything you might want to add later on, feel free to do so. Do we have a question that we might want to ask Greg before we move to Zaid? Dominic? Okay, you know what? Let's hear from Zaid first.
There's no questions in the chat box quite yet.
Okay.
But keep them coming, folks.
All right. Hey, why don't you tell us where you're from too, folks? Okay. So the next step, thank you so much, Gregory. And maybe we can chat a little bit more about some of that too, because it definitely intersects with healthcare work. And it is healthcare work. Shelter and housing is healthcare work at the end of the day. So our next guest is Zaid Nororsumar. Zaid, you want to introduce yourself? How you doing?
My name is Zaid, and I'm a communist. True. I'm a journalist. I've been covering I cover labor generally, but for the last several months, I've been covering sort of the care economy, mainly long-term care and home care.
Yeah. Yeah, you've had some excellent articles come out, and maybe we can share them with some people afterwards. But I know you've also covered a lot of just personal stories from people that you've talked to. I know you've even talked to Natalie quite a bit as well in gathering some of the information for your stories. Why don't you tell us a little bit about some of the stuff you've heard on the front lines?
Yeah, I should say that, 75% of journalism is possible because of the research done by the Ontario Health Coalition. And Natalie, anytime I want to go and look up something related to healthcare, even 20 years ago, I go to the Ontario Health Coalition's website, and it's really useful. And so today I feel like a bit of an imposter in Natalie's presence, but hopefully, I won't make a fool of myself. Just last weekend, I was contacted by a few long-term care workers who were concerned, who were actually terrified because the home that they work at is not providing adequate PPE. They have a small outbreak. It's not a big home. They only have they have 3 staff members who got infected, unfortunately, and only 1 patient. And the patient has been isolated in a private room. The problem, however, is that the workers, even the ones who are interacting with the COVID patient, are going in without an N95 respirator mask, which is supposed to provide better protection compared to a surgical mask. And they all thought that once they have an outbreak at their home, they would, have full protective gear, but that's not happened. And, it's devastating because we already have 5 healthcare workers who have died in Ontario. And as of yesterday, we had about 2,892 healthcare workers across the province who are infected. So we have, so workers are really, really terrified. And the home, I emailed them, called them up, they responded by email, and they were like, no, everything's fine over here. So I got through to the union, and I said, these workers are, talking about not having PPE, and the union investigated. And as of today, they've filed a grievance. But the workers are like, until this is resolved, we won't put our lives in danger. Like, we can't go back to our homes and infect our family members or, our communities if you're not given that protection. And this is sort of playing out across the healthcare sector in Ontario. And it's a really big problem. And, the worker that I was speaking with said to me, we feel expendable. They feel neglected, they feel heartbroken, they feel uncared for, they feel abandoned, and it's causing a lot of stress. And what's really sad is how much these workers care for the patients. A lot of them care really deeply. They understand how vulnerable the residents are, and they want to be there to protect them. But if they don't have the right protective care, they can't do that. And we know that even before the pandemic, conditions in nursing homes were really bad. I think about 80% of nursing homes have been routinely short-staffed. And despite the risk of this virus, workers are not, getting the PPE. And the government and some other experts have said publicly that the N95 respirator mask is not essential based on the evidence of how COVID-19 spreads. However, the unions have argued that workers should be protected based on the precautionary principle, which dictates that you don't need to wait for scientific evidence, but you should err on the side of caution. Yeah. But the government's guidelines are not based on the precautionary principle. They're based more on the supply shortage. So I spoke today with Jim Brophy, who's an occupational safety expert who works with QP, and he said there's growing scientific evidence that necessitates the use of an N95. And the most sort of exasperating thing is that this is not a new story. It's happened before with SARS, when healthcare workers were effectively not heard when they demanded better protective equipment. And the SARS Commission report in 2006 warned the government of future pandemics, of future outbreaks, and said they should have stockpiles of N95 and other PPE. And in fact, there were other government reports too about potential future outbreaks. But in 2013 or so, when the N95s expired, the government did not replace them. And that's a really fundamental question to ask, like, why did the government not replace those masks and the other PPE? And in my conversation with Jim Brophy, the occupational health expert, he attributes this to neoliberalism, which makes sense because we have a government or a state that's been steadily slashing taxes for corporations and for the wealthy over the past 35, 40 years, and at the same time is not able or has not been willing to invest in public services, including healthcare.
Mm-hmm. Zaid, I love how a lot of your articles really drive that home, because I do think that is such an important aspect to what's happening now. Long-term care homes are for profit, just like housing, right? It's for profit. That's not a good sustainable model, and it's being proven how unsustainable it is. Everybody's waking up to that now, right? So not just the people who have been, suffering in like overcrowded for-profit long-term care homes, like 4 or 5 people to a room sometimes if you're on a basic income. But it's also, we need to move away from this privatized system and commodified system that makes money off of the basic needs of our elders and most vulnerable in our community, right? So I love that you always drive that home in your articles.
I got this from the Ontario Health Coalition's report, I think last year, when I was just researching this, and I was like, wait, this is what's actually happening behind the scenes, because, and this is really frustrating for me as a journalist when I read articles, it's like, why is this information not provided? And, you read these reports that are just, there at, just gotta click and Google some of this information and it pops up. And I'm like, why is this not being presented? So, for me, every time I write an article, I'm always talking about the systemic issues. And sometimes I feel like I'm repeating myself, because I think the same paragraph in my article keeps repeating in every article, but I also feel it's kind of important to highlight the fact that, everything is, because when I spoke to researchers, when I spoke with people like Natalie, they're very clear in their analysis of how the industry has been shaped by these factors, neoliberalism and austerity, and then privatization. And it's a very toxic combination, because you can have a wholly public system or wholly nonprofit system, but if you don't fund it properly, you'll still have a lot of these issues. And so that alone, it's very important, but it doesn't explain the entire story. So these two factors, the way they kind of, make this noxious mix, are really important to understand. On the one hand, we've been underfunding the sector, and on the other, despite the underfunding, we talk a lot about, how do we pay for things? But it's like, you have 58% of your homes are for profit. And so that means, and every home, regardless of whether it's nonprofit or municipal or for-profit, they're funded at the same base level. And so a channel of that, a section of that money is being channeled away to profits. How is that not a consideration when making policy? It makes no sense whatsoever. And then on top of that, most people know that 58% of our homes are for-profit. What's not known so well is the privatization within the entire industry. For example, there was a report, a research report from 2015, and what it said was, by the end of 2013, about 18% of nonprofit homes are managed by for-profit corporations, and 3% of municipal homes are also managed by for-profit corporations, which kind of really began emerging in the late 2000s. So right now, I'm not sure what those numbers are, because those are not available, and the government website doesn't really have that information available. I tried to collect it, but it's not really easy to figure this out. But I would think that, if it was 18% in 2013, it's probably, 25%, so even more than that now. So that's also a trend. And then we have housekeeping, laundry services, and food services, which are also contracted out to private sector. And that's again a big problem because I think for most of us, food is a big part of our daily lives, and we enjoy eating. We enjoy good, nutritious food and fresh food. But a lot of these long-term care homes are getting food delivered from trucks that's prepackaged. It's not it doesn't look appetizing. It doesn't when you make food at home, for example, you can sort of smell the flavor, and you can sort of start to get excited about food. But there is not that long-term care homes, so these places have become like really dreary sort of warehouses, and it's down to privatization. But also the other part of it is that, which is also never really mentioned, is that it's a corporatization of the entire sort of economy, right? Because if you are slashing corporate taxes from like 38% federally in 1986 to 15% now, which is more than double, then you won't have the money to fund public services, including long-term care. And so it's funny because even though the homes are underfunded and the long-term care homes are always saying, well, we can't, we don't have the money to actually, hire more staff or whatever. And that's kind of true that it's underfunded, but at the same time, they are making profits. And the person that was speaking today, she was so outraged because, on the one hand, her life's in danger. They don't have enough staffing. She was like, even before COVID, it was the ratio of staff to residents was 11-1 on a good day. On a bad day, it was 21-1. And I want to read you her quote before I finish, because it's really, it was heart-wrenching for me. She said, the ratio was 21 residents to 1 staff. It should be 11-1, which is bad enough. Our hall has the worst behaviors, heavy workload, and every resident needs assistance. In the other hall, behaviors are more manageable. There are more independent people who can do more for themselves. I work the other halls too, so I know. My coworkers and I love our residents in our hall. We could ask for reassignment, but we don't want to, but maybe we should have. And it kind of speaks to the emotional labor that these women, and 90% of person support workers are women, and most long-term care workers are women, and oftentimes racialized as well, or immigrants and new immigrants. And it's sort of the emotional labor that these workers go through, and it's really disgraceful that we have these workers and the residents in these really wretched conditions.
Yeah, and I think I like that you hit on the emotional labor aspect of this work, and now too, like even we're seeing in the shelter system, like workers are their anxiety levels even higher now going into work because they're also working. There's 30 clients, 40 clients for one person, and that's a lot. You're listening to their stories, you're listening to their emotional traumas. You're given naloxone to 2 and 3 people a night lately. Like seriously. There is a question though. Dominic, did you want to read a question?
Sure.
Oh, okay.
Again, hi comrades. There's 2 questions. One, from a labor perspective, do you think that the general public's increased awareness around the essentiality of workers during this pandemic will preserve into the future? Do you think it will have any impact on the treatment of workers going forward? And then there have been a few comrades online that have been wondering, how can employers, whether in shelters or other facilities, get away with not providing PPE to the frontline workers? So those are 2 questions for you to consider.
Yeah, and Natalie might touch on that second question there, I think that. But yeah, but go for it, Zaid. Yeah, what are your thoughts on those questions? Zaid?
I think we are definitely seeing, or maybe I'm in my own bubble, but I think in response to, well, we can see this in the media. The media is actually talking about the for-profit long-term care homes, which I probably had to look at like 200 to 300 articles on this issue written in the last 5 years or so, and I think like very few spoke about the fact that 8% of homes are for profit, and then fewer still spoke about barely any spoke about the fact that for-profit homes have been proven to be much worse than nonprofits through academic research, because there has been a lot of research too. But I think we're sort of seeing a change in that trend in the last 2 months. You look at, a lot of news outlets have been talking about this, and you can also see this on social media. And I can see this in response to my own articles and other articles as well that I've been, seeing on social media. And people are definitely talking about about the fact that it's much worse on labor, on the workers when homes are for profit. And they're also demanding that, a lot more people are demanding that this should not be the case anymore. So I think we will see some change, but obviously the danger is that there's a lot of obfuscation. So last night, for example, I saw a story on CBC about, for-profit homes being worse, but then later on in the article, there was a subheader that said that, how do we pay for it? And, that's always sort of it's a very Canadian thing, I think, that I've noticed as an immigrant who's fairly new to this country, where it's like, how do we pay for it? Where it's like, well, have you been noticing the sort of and it's not really fair, I can't really blame people per se, but it's the gatekeepers, the media, and it's the political class that doesn't really talk about this issue of austerity that's been forced on people, and it's not so much the spending that's always sort of spoken about, but it's a revenue part of it that's never really discussed, and we need to address that.
Yeah, thank you for that. Yeah.
So we have a quick question from Stuart. Do you want to take it now? I think it would go
yeah, I'm actually
to Dave.
seeing it.
Yeah, so I could read it for you.
Yeah.
So Stuart writes, thanks Stuart, what has been the response of the City of Toronto to the housing crisis? And there's a reference to Tory saying he would not take the advice from left-wingers like John Clark and OCAP.
Right.
So I don't know, John's not on this call. He likes to join us sometimes.
Well, I think it's interesting, that second part, maybe, Gregory, and you can jump in anytime here. But I know for that second part, OCAP and a lot of homelessness and housing advocates, for that matter, have often been pushing for the expropriation of vacant property and vacant homes. Yep. to redo them, and to not push people out into substandard housing that's way far out of where they're used to being, which is usually downtown. So we've been pushing for that stuff. So meanwhile, now what's happening is the city's response during COVID is we are looking at hotels to have to shelter people.
Like, go figure.
Exactly. Hey, and guess what? It's working out, isn't it? Right? Because it has to. When you prioritize something, you prioritize housing and shelter as a human right, because you need to, it's also a healthcare issue, then you make it happen, right? You make it happen. So Tory has been coming through. It's been a slow response. And I know Gregory, the faith-based groups that put out a letter to the City of Toronto right now advocating for a speedier response, because there's people still not being able to access proper sanitation and hygiene. There's only 5 areas right now in the city that only came out this past week where people who are homeless can actually have a shower, because services were closed down. Many, oh gosh, what's the number of, Gregory, maybe you can help me with this.
Yeah,
the number
very briefly around the housing piece.
Yeah.
So, I mean, up until the early 90s, in Canada, we were building 20,000 units of affordable housing a year.
Yep.
And the first the federal government basically said, under Chrétien, said we're not going to do that anymore, and then the province said we're not going to do that, by and large, do that anymore. And so all that was downloaded onto the city. And so while we primarily pick on John Tory in my advocacy, definitely the federal and the provincial government, there's billions of dollars that should be being spent on affordable housing, because the market, as we know, the capitalist market does not produce affordable housing for everybody.
Exactly.
And so, I mean, that's the housing question that Engels posed.
There's also, I know, there's been quite a new information coming down the line too the last couple of weeks. I work within the rooming house congregate living sector of people who used to be homeless, and right now, so a lot of publicly owned rooming houses are being operated and run by nonprofit agencies for housing supports, right? Because people who have been homeless for a long time, they really do need housing supports. There's mental health issues and addictions issues that they need housing support workers to support them with, so they don't continue to lose their housing or burn it down or whatever. But there is discussions to speed along renovating a lot of these older rooming houses. However, this is the constant problem with the housing sector. When it's highly political, they tend to want to speed things up, and then it becomes an unsustainable model, right? As opposed to always just prioritizing that on a regular basis. Then it would always be working towards a sustainable model where housing is valued as a human right. So that's my 2 cents. I know we are running a couple minutes over time, and I do want to, so thank you, Zaid, thank you, Gregory, and thank you for your questions. Natalie Mehra from the Ontario, where are you, Natalie? Natalie, are you here? Did she step
She's
away?
on the right side.
Natalie, you know what? Introduce yourself. I think it's a good that you're kind of coming and speaking right after Zaid just spoke. So introduce yourself. How you doing?
I'm fine. My name is Natalie Mehra. I work as the Executive Director of the Ontario Health Coalition, and our job is to protect public health care under the principles of the Canada Health Act. So Zaid really covered long-term care, I think, very well. I'm just going to run through, and Zaid, by the way, just to, you know, you are an amazing researcher and have done tremendous work. So, you know, so that you know, you have nothing to be humble about here. And thank you for your compliments. So we've been, since the beginning of the pandemic, the declaration of the pandemic, we've been tracking the outbreaks. We started with tracking the outbreaks in long-term care homes around March the 12th, when the first outbreaks were, became evident, became public, and really kind of forced the government to have to actually track those numbers and report those numbers. And you know, we have been getting attention to the conditions in the long-term care homes in part by just doing the slogging work of tracking the outbreaks all across Ontario through all of the contacts and channels that we have and getting that information out. And really, you know, they're not stopping. I think the sort of key information that I would like to bring is that, one, we know more about what's happening in long-term care homes and in hospitals and in retirement homes to a lesser extent because of the activism and the scrutiny of public interest groups like ours that have forced the government to actually break out the reporting for those things. It's telling to me that there isn't reporting, separate reporting. Every day on the Ministry of Health website, if you click on the yellow COVID-19 bar, you go into the daily statistical summary, the daily summary of cases, and then you go to the epidemiologic study, and you can see how they've broken out the data. And that has been in response to pressure. You know, starting with the work that we did, you know, whatever it is now, a month and a half ago, and really pushing for those numbers to come out. But those numbers exist also in other congregate care settings like developmental services, you know, places where people with disabilities or mental health, developmental disabilities and mental health issues and other types of congregate living, other types of developmental services, shelters, obviously. And you can see the sort of differential in the sense that that data isn't reported. But from what we do know, this is what I can tell you. I can tell you that the outbreaks continue unabated in long-term care, and they're very serious. At this point, I think Zaid mentioned there are 2,819 residents who are currently positive. That doesn't include all of the ones that have now recovered. 1,621 staff, so more than 4,000 all told. More than 1,074 residents dead from COVID-19. 3 long-term care staff dead from COVID-19. In retirement homes, that's in more than 200 outbreaks. There's 630 homes approximately. In retirement homes, 79 outbreaks that the ministry is reporting. We found more than that. I think we're up over 90 now. all told, 500 residents, 268 staff, 98 residents died. Hospitals, 69 outbreaks. That's out of 250 public hospitals. 254 patients, we found way more than that. Staff, 271, deaths, 40. I mean, when you total up the numbers, then they're going up by about 1,000 a week in terms of the number of people infected, and the deaths are also climbing. Today, we did a big study looking at the differential in the death rates between the for-profit and not-for-profit and public long-term care homes. And I wanted to sort of flesh out a bit of what Zaid said about them, because I think it would be of interest to you. So what we found was that the death rates are higher in the for-profit long-term care homes. There are more outbreaks. There are more people infected. There are higher death rates in the for-profit homes than in the not-for-profit and the public. And that rate from last week, so April 28th to March 5th, has grown at double the rate in the for-profit homes to the not-for-profit homes, and it's actually declining in the municipal, the fully publicly owned homes. The difference between them is quite dramatic when you look at how they operate. The municipal homes pay better, they have benefits for their staff. Consequently, I mean, all of the homes had a staffing crisis leading into this, but they did not have the same level of crisis as the for-profit homes. The for-profit homes in the last 2 years, as we've seen a really very serious PSW crisis emerge across the sector. The for-profit homes, there are 4 large chains in Ontario, Chartwell's, Sienna, Extendicare, Rivera. Of those, 3 of them are traded on the stock market, and you can follow the dividends that they've paid, tens of millions of dollars a year in dividends to their shareholders, even as actual care levels were declining, even as the acuity, that is the complexity and the heaviness of the care needs of the residents, was rising, even as a staffing shortage, a critical staffing shortage emerged. Before COVID-19 hit, we did roundtables across the province with PSWs and their unions, with home administrators, the college, the people that run the college courses on PSWs and so on. Altogether, 350 of them came out. There was total consensus. Every home, every shift was working short-staffed, critically short-staffed, worse on evenings, worse on weekends, worse in Northern Ontario. And these things now have been, laid bare in a way that nobody can ignore during COVID-19. I talked about deaths. I just want to say that, the other thing I wanted to say about the for-profits is that their impact on the industry as they see it, the market as they see it, but the service as we see it, is profound. I mean, our chief opponent in advocating for minimum care standards, even just for yearly inspections of the homes, unannounced inspections of the homes, in the standards, all of the standards of the physical plant, the safety of the physical plant, the standards around care, like how often you have to brush people's teeth and putting labels on their clothes and so on. I mean, they have lobbied relentlessly for deregulation, for moving money over to envelopes from which they take profit and so on. And they have dominated, they have had disproportionate influence, to the point that they actually, since the Ford government got elected, they actually canceled the annual unannounced inspections of Ontario's long-term care homes, something that we've won, and then they've deregulated, then we won again, then under Deb Matthews, when she was health minister under Kathleen Wynne, they deregulated, then Eric Hoskins came in, we won it again. He actually brought in fines for enforcement. Then the Ford government came in and they stopped the inspections again. That's the power of this industry. And looking at the connections between them and government, the connections are profound. Right. Shelley Jameson, who sits on Ontario Health, the super agency of the province, she was the vice president of Extendicare. She went over to the hospital restructure, the Healthcare Restructuring Commission under the Conservative government, the Mike Harris, Ernie Eves Conservative government, ordered the closure of half of the 5,000 chronic care hospital beds in Ontario. Then they awarded 20,000 new long-term care beds, a whole boatload of which went to Extendicare, moved back to become the president of Extendicare, then became the president of the for-profit lobby group, became the secretary to cabinet under the McGuinty government, the head of the public service under the Kathleen Wynne government, and now under the Ford government is on the board of Ontario Health, the new super agency. Bill Davis, you'll remember him, former premier, conservative premier. He's on the board of a for-profit long-term care chain. Mike Harris is on the board of Chartwell. Ernie Eves served on the board of Central Park Lodges, which is one of the chains that was consolidated.
What a business.
Sorry?
I said, what a business.
Yeah. Paul Tuttle, who was the director of the long-term care sector of the ministry, moved over to become the president of Extendicare when he retired. It's a revolving door between government and the long-term care industry. And so when you look at what we're up against, when this pandemic is over, when you look at what or even now, what we're up against when we're trying to force money to go to care, to the care levels, and in long-term care, the conditions of work are the conditions of care. There is no difference, you know. So if your workers are poorly treated, if they're paid low, if their pay is low, if their working conditions are poor, if they get injured at the highest rate of any industry in Ontario, which is the case in long-term care, if the homicide rate in the homes, the violence rate is the highest of any large urban center that we have, then of course people vote with their feet. They leave and they go elsewhere, and it leaves the homes critically short-staffed and unable to deal with even normal times, let alone this pandemic. Today, we see some homes are down to 30% of their staff or even less. People that are being admitted to hospitals from long-term care homes are anorexic. They are severely dehydrated and malnourished. They're starving to death because there is not enough staff to provide them care. I'm not overstating the situation. It is, there's not enough words that mean crisis to describe it. As we have moved through this, the government really has not undertaken any permanent measures to improve the situation regarding staffing, to improve their wages or working conditions. There are no concrete promises. There is a lot of theater on the part of Doug Ford, much as in the election. This is not a new socialist Doug Ford. This is exactly what happened in the provincial election, where he knew how to be populist and say what people want to hear. But the actual measures that have been undertaken, the actual commitments are very, very thin. And in fact, there's nothing at all that would deal with the ownership of the sector, the wages and working conditions of the workers, improving the amount of care, like none of the major things, infection control, that need to happen in those homes. We have a fight that now the Canadian people are enormously more educated about, enormously motivated to help. Our job now is to provide the tools and the ways for them to join in a fight that is commensurate to the strength of the forces arrayed against us. And I tried to sort of give you a picture of that. Just to end, is it okay? Have I gone on too long?
Yeah, I mean,
No.
I think you're really hitting a lot of points. And you're touching on something I'm hoping you're going to expand a little bit more on, and that's like, how can people help make this change happen that you're speaking about?
Okay, well, I just wanted to take 1 second, if it's okay.
Absolutely, go for it. Yeah.
Sharon
Take
Roberts, we can't name all of the more than 1,000 residents that have died because we don't know their names at this point, but we can name the staff in healthcare. Sharon, they didn't have proper PPE. They're pretty much, I think they're all racialized, you know, and yeah, they're all racialized in Ontario, I believe. Yeah, they are. Sharon Roberts was a PSW at Downsview Long-Term Care Home. Arlene Reed, a PSW in home care, mother of 5. Christine Mandagarian, PSW at Altamont Care Community in Scarborough. A cleaner who we don't know the name of at the Brampton Civic Hospital. Diane Chin, an environmental services worker at Sunnybrook Hospital. You know, these people went to work. They were scared to go to work. They knew that it was dangerous. They were not given the appropriate PPE. They knew that. They were all in their 50s, and they are all dead, and more to come. And I just think that we have to find a way to ensure clearly what's happening now is not working. The PPE, even that the workers have now, is not working. The spread is not stopping. The isolation is not working. The testing is not complete. There are thousands more people, you know, there's almost 80,000 people in those homes, and in the retirement homes, countless numbers of people who are at risk of death, very, very imminent risk of death if this isn't stopped. We need to get more militant now. I think we need to mobilize somehow. We have to figure out a way in a pandemic to mobilize to stop this. There are concrete measures that can be taken. We've listed them, you know, all of that stuff, but we have to make that happen. And we need the commitments while we can get them now, while the population is awake and alert to this and completely behind us. So I don't have the concrete answers, and I don't have time to give them anyway, but I just wanted to say, we have the opportunity. I think we could overcome the for-profits now, but we have to do it. And that means that we have to find ways to force actual concrete commitments and not just the kind of political theater that we've been seeing.
100%. Wow, there was some powerful stuff there. Thank you so much. And I know you've been doing an action, which I know it might be a small token, but it still can be powerful right now, which is the action you just had.
Oh, it was an online rally. It was like a virtual rally.
Thank you.
And it was great. And about one day, a notice, about more than 1,000 people joined, holding up placards and taking a photo of themselves and posting it on a Facebook event page to join the rally. And we're going to leverage that into, you know, letters and so on and so forth to the for government and other things. But yeah, but we need to sort of do a lot more and figure out some ways to make it impossible to ignore, or impossible to just sidestep with, you know, some comment that doesn't really mean anything from the Premier.
Can we still be using those hashtags though in an ongoing way, like hashtag
Fix LTC Forward, yeah.
Fix LTC Forward, yeah, and I put it in the chat bar. So definitely use that. What about joining the Ontario Health Coalition? Does that make an impact if we could do something like that?
Oh, it's huge, yeah. I mean, the more people we can say that we represent, if people, you know, $20 memberships are the memberships if people can afford, that obviously helps, because all fundraising has stopped. So yeah.
And I hope you can write an article for the People's Voice, because I think a lot of, and Zaid as well, and Gregory, please consider writing an article about these issues for the People's Voice. You know, with concrete ways on how people can get involved too, Natalie. I think that's great. Thank you.
Thank you.
So Jen, I've been looking at the chat list. If when you're ready for that, I can jump in.
Yeah, if there's Natalie, I think we're at 8 o'clock now. We're 2 minutes after 8. I feel like before Helen speaks about things that we want to put forward as the Communist Party of Canada, we can take a few questions. Let's do about, you know, a couple questions for Natalie, and then we can open it up to everybody else. What do you say? Go for it, Steve. Go for it.
Sure. So if people could write in their questions now. There's been great commentary, mostly expletive deleted kinds of commentary, but no specific questions. Unless, Dom, you can pick up on one. I hope people are watching the chat box, because Vinny gave it like amazing little intersection here. Farah, I'm just going back, Greg, Susie. Yeah, like we need some some good questions. I was going to ask Natalie something, but I'll hold that. Dom, do you have something?
I did notice a question that Greg responded to about the low level of testing, and what your thoughts are on the reason why we still got such a low level of testing in Ontario. Is it that the government's nervous about how terribly they've handled the pandemic? Or Natalie, do you think there are other reasons why the testing rates have been so low?
You have to unmute.
Oh, Drew does.
Unmute.
Drew, can you unmute Natalie and Greg, please?
There.
Okay, sorry. Well, it's been going up, but at the beginning of the pandemic, public health asked the hospitals, the public hospitals, who could do the testing. So the public health labs are doing, there's an array of labs doing the testing. The public health labs are doing the testing. There were cuts to the labs, by the way, before this, obviously, as there were major cuts to public health as well, and restructuring across the board, as you know. The public health labs very quickly got to their capacity. I mean, they only have a certain amount of physical space as well. And they asked the hospitals, and virtually all of, I believe, as I understand it, virtually all of the large public hospitals said that they could do the testing. They chose 8 of them, I was told, and I think that's around right. I'm not sure to what extent it's changed now. But so they chose 8 of them. That number that you've been seeing in the media, that 12,000 number, 13,000 number, that is our capacity per day. That number is a very arbitrary number. We have as much capacity as we choose to have, provided that we can get the actual testing kits and the reagent. Well, we can make the reagents here, but the testing kits. So there are certain types of labs that can do certain types of things. Without getting too down among the reads on this, the bottom line is all of the large hospitals, most of the hospitals have the ability to do the testing. They are managing to get the swabs and the kits and so on through different suppliers. So it does not appear that there actually is at the moment a severe shortage of the swabs or the kits. So it was an arbitrary limit. At the very beginning, Public Health Ontario chose a very conservative approach and said that you had to have an array of symptoms, and then you also, in addition, had to have either traveled in the 2 weeks prior or been in direct contact with a confirmed case in the 2 weeks prior. And they didn't actually loosen that up until just over 2 weeks ago. And so people who had symptoms, even severe symptoms, were not able to get tested. It was only 2 weeks ago that our Chief Medical Officer of Health, Dr. David Williams, even had the Deputy Minister of Health sent correspondence to the public health units to tell them that all staff and all residents in long-term care homes needed to be tested. That was after thousands of people had been infected in the homes. And that order has not, it's not an order, it's a directive, has not been done yet. I mean, even in the homes with outbreaks, that has not been done. So the issue is obviously a capacity issue. It's also because we've had a very, very slow and conservative approach by the Chief Medical Officer of Health. He's saying that he wasn't given the resources by the Ford government. The Ford government is saying it's public health's fault. It's a bit of a shell game. What's very clear is they set an arbitrary limit on how many labs were going to do the testing. They could actually scale up more and more and more if they wanted to. That's still not really happening.
Thank you.
Just very briefly,
Sorry.
a big thing we've been fighting for is mass testing in shelters. And so, for example, we know that in the shelter in North York, 5800 Young, there was an outbreak. North York General Hospital stepped in and tested the whole shelter. There was just over 200 people in the shelter. I think the last count was around 156 of those people tested positive.
160.
Right? It's the largest outbreak in a shelter in North America.
Yeah.
Right. And so we have positive cases that we know of in other shelters, and Toronto Public Health is choosing not. So the city rightfully blames the province because testing is the province's portfolio, but from what we understand, this, I don't know if it's been leaked yet to the media, but basically, as we understand it, Toronto Public Health is standing in the way of a number of other shelters that need to be tested because there's a few positive cases and they're not doing it.
Yeah.
And we're convinced for 2 reasons. They just don't want us to see how bad it is. And frankly, they don't have places for people to go, right? So
the last 2 weeks, it's now over 200 cases in the shelters, right? Yeah. With the largest one being the refugee shelter in North York.
So Jen, we have 4 questions now.
Okay.
I'm gonna hold mine until I do my 2-minute thing.
Yeah.
But the question, just summarize the questions, and then Natalie can take whatever she wants.
If we could give about a minute answers to each question would be.
So I'm going to pool the questions so you can get a flavor of what they are. Then you get 4 minutes. I don't know.
Okay.
So Juanita asks about the question of what what are safe masks, right? In a long-term care facility. Elizabeth asked about the military that are going into some centers and how are they being received. Farah asks, how do we compare the kind of blind eye attitude towards our long-term care facilities by previous governments before COVID and during. Dominic asks something, here you are, about the redeployment plans that are being considered, like in Quebec, you know, educational workers are being sent by the government into long-term care facilities with no training and so on. So that's obviously on the agenda somewhere here. And how's that work out? Like, what's up with that? Semo asked this question: how do you think the governments across Canada are handling the diseases? All around the world, the numbers of deaths, according to, you know, the various sources, are decreasing. But in Canada, the daily deaths seem to be going up as of today. So there's a variety. So
yeah,
what?
I think that Simo's question maybe Helen can touch on after.
Yeah.
After
Okay. So we'll just leave that. Yeah. So Natalie, if you're cool with taking some of those, that'd be great.
Yeah. Natalie, what about those masks? The mask question about, is there a standard? Oh, you got to unmute yourself. Sorry, unmute yourself. Oh, Drew. Sorry, Drew. Yes.
Drew, unmute.
Unmute Natalie, please. Maybe the mask question, is there actually a standardized, Drew, do we have, thank you. Is there a standardized acceptable mask for people in long-term care, health care?
Right.
I guess that's a simple one to answer.
Well, you know what? No. I mean, if you look at the pictures on TV and so on of people in Southeast Asia, they're in full hazmat suits. They're not having testing centers with people in surgical masks and a face shield that might be printed by some child, you know, at home. Yeah. That is not happening, right? So no, I mean, we are definitely on the wing it side of the PPE. The chief medical officer of health a few weeks ago said they didn't need PPE in long-term care. They shouldn't need it if they could keep COVID out of the homes. I mean, it was just betrayed such a lack of understanding of the long-term care system even. And then very slowly sort of changed. The unions have won some concessions and an agreement that, you know, there'll be a risk assessment of every case and then a decision about what the PPE would be. But still, I mean, obviously it's not working. Yeah. There's what, more than a third of the hospitals going up all the time have outbreaks. You know, there's more PPE obviously worn in the hospitals, but the outbreaks are happening. We hear of allied health professionals like phlebotomists and people like that who are wearing surgical masks while taking blood, bending over patients with COVID-19. That is not happening. I mean, obviously that's happening in the UK, that's happening in the United States, but, you know, no, they should be wearing N95 masks, and, you know, they should have access to them and they should be able to wear them. Clearly, there are a lot of outbreaks that are happening among staff that are well trained in donning and doffing and all of that stuff. So what is happening now is clearly not working. Yeah. There are also very severe shortages and people are wearing garbage bags and things right now still, right? So no, you know, it's not adequate. I don't think it's adequate at all. And you know, everything that I'm saying in healthcare applies. I'm looking at Greg to the shelters and to developmental services and to retirement homes and so on, you know, 10 times fold, you know, it's much, much worse. And so it's a very serious problem. In terms of other governments, you know, long-term care, the chief way that governments for 30 years have cut costs or constrained budgets and constrained supply of healthcare to less than population need has been by cutting chronic care and long-term care. So all governments have done it. Every piece of care that has been moved out of hospitals has been largely privatized. The majority of it is privatized and handed over to for-profit companies, which is, after all, the plan. So both to cut funding and to turn over the ownership. And in terms of the military, you know, the bottom line is there's so few staff. The crisis, the shortages are so severe. There's so many people being isolated because they've tested positive or they've been exposed, and there are just so few staff that that I think anyone going into the homes is welcome. But the problem is it's sporadic. It's not coordinated. The province is following its kind of laissez-faire belief system about managing this. So homes have been left to make partnerships with hospitals on their own voluntarily, to bring in these so-called SWAT teams and things like that. So I don't think the issue is really around how the residents are welcoming the people or who they are. I mean, they're all trained, but the fact that there just are not enough, that it's a chaotic and uncoordinated approach, and redeployment of other people is a possibility. But like, we can't forget that the acuity, that is the complexity and the heaviness of the care needs of these residents, is very, very high. There's a lot of they're psychogeriatric, like they used to be in psychogeriatric hospitals, or complex continuing care beds in hospitals. Now they're in long-term care, funded at 1/3 of the rate, but with incredibly complex and high care needs. So you do need to actually have trained people go in, and there's no path out of this without stabilizing the workforce. So it has to happen. Eventually it's gonna, you know, so sooner than later would be a good idea.
Totally. It's very similar for deployment of workers in the shelter services as well, working with people with heavy addictions, mental health, lots of trauma backgrounds. So there is some redeployment happening there too, or intended to happen, with the City of Toronto taking some workers from Parks and Rec and bringing them into some of the emergency shelters that have been open for social distancing purposes and social isolation purposes. So yeah, to answer Dom's question. We do need to move on a little bit. It's 17 minutes after 8, so I will apologize right now if we don't get to all of your questions, folks, but we're going to introduce Helen. Helen is probably going to address some of those questions that were mentioned in what she has to say. And just before Helen, if you can give us a minute update on what's happening with CUPE. Stephen Seaborn is a member of the Public Sector Workers Club, but he's also on the executive of CUPE Ontario. And I know there's been lots of stuff happening with CUPE around, you know, getting this critical stuff addressed for workers. Can you give us a quick update?
Sure, very short. And I was hoping Natalie, I was going to ask this question of Natalie, and Natalie, you may still be there. So here's the thing, 60,000 of our members in Ontario of CUPE, of the 280,000 members of CUPE, 60,000 work in the health sector. A whole bunch of them in hospitals and long-term care and city of, you know, there are also municipal workers who work in healthcare. But today, our union announced that we would be taking the government to court on a legal case, which is a case of failure to comply to protect workers. So there's a responsibility under the law, under Health and Safety Act of Ontario, to actually, for employers to comply to protecting the workers in employment. So this case, as I understand it, and it just came out, we haven't had a board discussion on it, it will be on failure to protect. So I was just going to ask you, Natalie, did you have anything you could add to that? I'm sure you have more details, actually.
Just that a number of workers tried to refuse unsafe work, and the Ministry of Labor, the inspectors were told to hand those cases over to supervisors, and they were, I don't know if all of them, it looks like all of them were refused. They were found against the workers. I think there has been a failure, a total failure on the part of Public Health Ontario and the government, and the existing health and safety practices that we have under the Act to protect people. And
Right.
it cannot be that workers can have to complain, you know, about unsafe work to the ministry, which is then following the guidelines if they're the wrong guidelines, unsafe guidelines from public
Yeah.
health. It's a circular thing, right? So coming out of this, there has to be a different way, whether it's, you know, what the chances are of the court challenge, I have no idea, but it's, I'm glad that you're raising it.
Yeah,
Thank you.
thank
So
you.
that's it. That's pretty much all I have to do in 2 minutes. So over to you.
Thank you so much, Stephen.
Okay.
And thanks again to Natalie, Gregory, and Zaid for joining us tonight. Really important stuff, and I know some in the chat bars too. If you're reading, there's some other discussion on the side that's happening that's also quite relevant and important. Next up, we have Helen Kennedy. Helen, can
Yes.
you tell us a little bit about yourself?
Sure. I am a member of the Public Sector Workers Club. I'm also on the provincial committee of the province and also on the central committee of the Communist Party. I also was a longtime QP member. I'm still a QP member, but I'm a retiree now. This has been really excellent. I don't know if you want to see me. I'm okay with you not seeing me, but I don't have any control over that, so that's fine. I just want to say that this has been really great, but I think that it's also been really, making me really angry and really frustrated, because we have to move from this horrible place that we are in the world right now to what the hell can we do about this? And I have some suggestions. Number one, I think overall, okay, sorry, start my video, there. There we are. Okay, so that what we need to do overall is today, after this meeting, send in your support to the Ontario Health Coalition. They do enormously incredible work that needs to be supported. That is number one. The other thing is that because that's another proposal. I think Zaid mentioned, like, how are we going to pay for all this? $25 billion, friends and comrades. Can you hear me? Can you hear me? I'm coming in and out. $25 billion is what Canada spends on the military. $25 billion that they could invest in a healthcare system across the country that would not need to send the military into long-term care homes, but have properly paid personal support workers and staff that could fix the system. To invest that $25 billion in making the systemic changes that we need to get rid of, as Zaid also said, the profit margins that are being made in long-term care. I put some of that in the chat, the millions of dollars that CEOs of Chartwell and Extended Care are making and taking out of our parents and grandparents' dinners and care and everything else. That can be invested. We need to make sure that the long-term care sector is actually part of the healthcare sector that is not for profit, that is accessible to all, that is a universal system that everybody can access. I think the other thing is to also addressing the crisis in homelessness is the whole problem with the EI system, unemployment insurance. You know, we need to make it non-contributory so that everybody has access to it, whether you have worked or whether you are a migrant worker or you are the undocumented worker, that you have access to 90% of a living wage. And that is also doable with some little transfers. You know, just think of that, those millions of dollars that have been taken out of our system. In terms of also long-term care, we do need to make sure that they are all public homes, not-for-profit homes, ensure that helps. Integrated into the healthcare system so that they all have a hospital that can come in and do that testing. That would be possible. But we also need to expand that to look at pharmacare, dental care, vision care, mental health care. You know, that's the one that we don't ever talk about, the mental health care. And that we can look for all the needs, to meet all the needs of people who are the most marginalized. I also want to say a bit about who the people are that are most impacted by the COVID-19. We know they're the homeless, the people in long-term care. Those are predominantly women, number one. 60% of the people that have died from COVID are women, about 60, almost 60%. So it's a 60-40 split, right? Why is that? Well, women have the luxury of living longer than men so that they can die more often in long-term care homes. That's not the world I wanna live in, right? Who else is impacted? Women are the majority of the frontline healthcare workers, right? And racialized women are also mostly on the front lines workers. I used to talk in Local 79 as my local, it was the City of Toronto inside workers. We had our own little apartheid system because 25 years ago, it was the most racialized locations were the long-term care homes, right? I mean, it's a bit different now, but that because the long-term care homes were the lowest paid and the most marginalized, right? And that is probably, if you're looking at who are the people that died, I mean, Sharon, who's from SEIU, who's just passed away, was not only did she die of this disease, but she died alone at home. I mean, it's heart-wrenching. But these are racialized people as well. In the shelter system, the Indigenous population is overrepresented again. Who's overrepresented in the prison system? Indigenous people, racialized people. So this is a whole working class issue, right? In all its diversity, but it's not the Mike Harrises of the world that are going to be impacted by COVID-19. He made $250,000 just going to a few meetings for Chartwell, right? We have to, I mean, I think somebody said the other day, you know, the slogan that keeps coming back over and over, we're all in this together. Well, we're not, folks. The working class is at the bottom of this, and we need to be the ones that organize to fight back. There are other things that, you know, so we have a program. We have a program just from what everybody spoke about tonight, that we know the way forward. So I would say, in addition to supporting the Ontario Health Coalition, we could join the Communist Party, because this is the program we fight on every day. We have this program. We're doing leafleting in Parkdale. Just recently, our flyers have been up. We've had an unprecedented increase in the number of people applying to join the party. Right? Those are great happenings. And I think that this is also, I mean, when we look back at the Depression in the 30s, that's a time where the Communist Party grew a lot. So, I mean, we're not opportunists to say, yes, we can, because it's so awful, but we are the only ones that have the answers here, right? In terms of political parties. Greg also mentioned about, who he didn't mention who the councillor was, but we also have elections, municipal elections coming up, right? We need to make sure that our municipal councillors and our school board trustees are progressive folks, not just on paper, but respond and agree to this program that we have and that we share with many others. The other two things I'll just leave you with that we need to, we need to ensure, like in the housing sector, to cancel rent now, cancel credit card debt, cancel student debt. But in the long term, we need to be building long-term care homes that are accessible. We need to be building housing that is adequate, you know, and all of those things that come with, you know, developing a system that isn't based on capitalism, basically, right? You know, how do we rearrange the budget? So, but the two things I think that we can also, you know, unite around is, number one, we need to rebuild a national women's movement. It's been like 20 years since I was a member of the National Action Committee on the Status of Women. It basically collapsed because of identity politics and also defunding from the federal government. But we need one now more than ever, and I think that we need to take serious steps towards that. But we also need to rebuild a fighting and militant labor and social justice movement. It's not good enough just to have Natalie and the Ontario Health Coalition as being the only militant social justice coalition in the province. You know, like what we have an opportunity perhaps at the Ontario Federation of Labor. They're not as horrible as they used to be, but you know, the Canadian Labour Congress has been pathetic. I mean, their response has been, let's go and talk to businesses and the government and see if we can catch a deal for workers. No, that's not going to work. We need to have a militant fighting program. So I think that, you know, we can't do this one person and isolated at home. We have to do it together. And one of the best ways to do that is to join the party. So I'll leave it there and look forward to all your applications. Jen, you're on.
Oh, I can't. Jen, you're on mute. Okay.
How that was I had the power to do that time. So we are at the 8:30 mark. Like we're literally right on time right now. However, is there at least one other question that we might be able to put to the panel? Yes. That everybody might be able to touch on? Is there something that we can take from the chat? Dom or Stephen? Let's do Dominic?
Yeah, I think the sentiment is that once we emerge from this pandemic, we definitely need the labor movement and various people's movements and coalitions to focus on the struggles that you've talked about tonight in long-term care, in hostels, in shelters. And that's not always at the top of the list of the labor movement. So we'll need to continue to push them to make sure that they don't forget some of the most vulnerable and those who have been left behind during this pandemic. That's a sentiment that I'm getting right now from people in terms of their comments.
Yeah, 100%. And there's some really good discussion along the sidebar. Again, we hope to have this posted, this discussion tonight posted up on the CPC website. Drew, if you could put the CPC website up, that would be great, the link for people. And we'd also like, if you could send Helen Kennedy, Helen, if you could post your email. If people would like to join our Public Sector Workers Club for future educationals similar to this one, discussing workers in the public sector and beyond, so organized and unorganized workers, and just, you know, the conditions that we are up against, not just now during COVID, but on a continuous basis. Please send in your interest to Helen Kennedy. She'll post her email for you. Please send her an email and she will put you on an emailing list, okay? The hashtag, so I'm gonna do a quick summary, but the hashtag for the Ontario Health Coalition that we can all use on our social media. Natalie, what is it again? Hashtag FixLTCFord. Yes? Not? Okay. So a quick summary, and Dom did a little one too. We want to thank everybody for coming tonight, participating. To all of our speakers, thank you. Thank you very much. Really excellent information, and we really appreciate your time tonight. Again, please subscribe to Working Class Paper that talks about a lot of these issues we talked about tonight, The People's Voice. Send your email to Helen if you want to participate in future forums. The People's Voice link is on the side if you want to subscribe to that media source, or if you'd like to follow the link to PayPal to donate to The People's Voice. It's important that we keep these stories going, and The People's Voice is committed to doing just that. Something to remember that I'm picking up on a lot in all of the speakers and throughout some of the discussion on the chat is that many of these workers that we spoke about today that were part of that sector are essential workers around the world. And we're on the front lines all the time, and we are super on the front lines of COVID right now. We are often underpaid, mostly women, racialized people, and also struggling with our own health issues within our families and even our own personal lives. Health issues inflicted on us by the social and economic virus called capitalism, colonialism, and imperialism, social determinants of health. These workers, who many now like to conveniently call us heroes, need change, sustainable change, more than we need platitudinous praise. These workers need universal daycare, properly funded healthcare, higher and livable pay, safe housing and food security, and an environment free of war, racism, and abuse, just to name a few. Healthcare workers are in a caring crisis ourselves. So fighting for our own care is something we're doing while providing crucial, essential services like the ones we spoke about tonight. So please let's support our work, this work. Let's fight for resources for the populations that we serve, and let's support the rights and treaties of all the First Nations of Turtle Island and the land that we live on tonight and the land that we spoke from tonight. The fight for access to healthcare is a critical one for numerous First Nations, especially living in the Northern Territories. Clean drinking water and sanitation, the stuff that went through the Universal Declaration for Indigenous Peoples, is being completely ignored by our Canadian government. And this is all part of the healthcare fight as well. And we have to always align First Nation fights with every other fight that we do as working class people. We must remember to always include the fight against colonial violence in our work as labor activists and socialists. Things you can do today, takeaways. Support the Ontario Health Coalition. I posted the link in the chat sidebar. They're doing really incredible, militant, important work. Support the rent strike that's currently going on throughout, it's in the States, it's actually throughout the world. There's different rights strikes going on, but support your local rent strike, find it and support it. Join other actions that are similar to the rent strike. Follow and support Indigenous rights groups fighting to keep the land safe from exploitation and environmental degradation. Support union strikes and actions like Natalie and Stephen mentioned tonight. Organize a union in your own workplace and support those who are already doing that. Demand housing as a human right and not a commodity, and push hard for this, because right now things are starting to happen around that. Let's keep that momentum. Join a coalition in your local area fighting for food access and higher wages for workers. And join the Communist Party of Canada, because this is stuff we do every single day as communists. Read working class media like the People's Voice. So again, please consider donating to the People's Voice. And I would like to say, respect to the land, to each other, and to all of our relations. Chimigwich, Niawen. Have a good night, everybody. Again, thank you for joining us. Thank you. Bye, everybody.